Today I'm going to just give a brief, a basic introduction on HIV and AIDS, and then talk about the epidemiology, so the numbers, I guess, globally and then nationally, and then have a little focus on Victoria. And I've got a couple of slides about like a breakdown by country of birth and that sort of thing, so that we can have a look at potential vulnerable populations. Okay, so most of us in the room are very familiar with HIV/AIDS if we work in the sector, but there are some community members here who have probably heard about HIV but not exactly sure what it is. So it stands for the Human Immune Deficiency Virus, and it causes acquired immune deficiency syndrome, which everyone knows as AIDS. Early testing for HIV helps people to stay healthy and reduces the spread of infection in the community. There is no vaccine or cure for HIV or AIDS, but medication can manage HIV-related illnesses and AIDS. I guess what I can say here is that if someone is infected with HIV, it can take years before any AIDS-defining illnesses develop. So not everyone with HIV also has AIDS. And there are medications that are available that can postpone and prevent HIV-related illnesses developing or AIDS developing. The way HIV is transmitted, unfortunately, it involves a lot of things I guess we don't like to talk about. For example, unprotected sex and injecting drug use. But HIV is mainly transmitted through unprotected vaginal or anal sex, so without using a condom, with someone who already has HIV. Sharing needles, because it's also a blood-borne virus, so it can be transmitted through blood-to-blood contact. So sharing needles, syringes and other injecting equipment, or having a needle stick injury is a potential way of contracting HIV or being infected. Blood transfusions and treatment with other blood products can cause HIV infection. In Australia, that's not likely, but there are countries where there's higher rates of HIV, and clean syringes and needles are not always available and so on, and so there is a risk of infection. Again, unprotected sex with male or female sex workers in countries with a high rate of HIV infection or who do not work in licensed brothels. So it's important to say that in Australia, which you'll see later, the prevalence of HIV is much lower than other countries. And a big part of that is, well, part of it is because we've got a small population, but also a big part of that is because there was a huge effort in the early years when HIV first came around, so in the early 80s and 90s, there was a huge effort in Australia to control HIV infection. So the sex work industry, for example, it became mandatory that condoms were used 100% of the time with clients. Most states legalised sex work as well, so that if you're in a licensed brothel, then you need to have regular testing and, as I said, use condoms. Also, the gay community, condoms were introduced into the gay community, and they took up condom use quite well. And also the distribution of injecting equipment, clean injecting equipment, also helped to keep the numbers low in Australia. So when we talk here about unprotected sex with sex workers, the cases that we see in Australia are usually with sex workers overseas in countries where there's a much higher prevalence of HIV. Also, HIV can be transmitted from mother to child during pregnancy or while breastfeeding. So how to prevent HIV? So someone who has HIV may not have symptoms, but they can still carry the virus and they can still pass it on through blood or body fluids. As I said before, treatment doesn't prevent the virus from being passed from one person to another, so it's important to think about ways to prevent HIV infection. And some of these are using condoms correctly. So not just using condoms, but using them with water-based lubrication so that they don't tear and things like that. Using clean injecting equipment, as we've talked about before, and avoiding contact with blood where possible. So, for example, in clinics and hospitals in Australia, it's there are systems in place and procedures in place for healthcare workers to avoid contact with blood from patients and so on. There are other ways of preventing HIV that are being studied and have been shown to be effective in other settings. For example, circumcision and pre-exposure prophylaxis. So that means, taking a medication daily to prevent an infection if you've got a HIV positive partner. But that'll do. Okay, so globally, there are about 34 million people living with HIV. And you can see, depending on the region, there'll be a different prevalence. So in say, North America, for example, 1.4 million. In Africa, 23.5 million. I think that represents 1 in 5 as the prevalence overall. So obviously different countries within Africa will have different prevalences. Southeast Asia, 4 million. Some countries are high prevalence. And what I mean by high prevalence is that at least 1% of the population is infected with HIV. And then Australia, as you can see, is in a region where 53,000 cases of people living with HIV, but that includes PNG, New Zealand and other Pacific Islands. So in that whole region there are 53,000 cases. And also, I guess it's important to know too that the HIV epidemic does change over time, so it's been around for a long time, and we know that there are certain countries or certain areas or certain regions that have a higher prevalence of HIV, but that is changing. So there are 2.5 million new infections a year on average. In the past few years, there's been around 2.5 million, and this is different to what it was years ago. So there's fewer new infections occurring in some regions, for example in Africa. A lot of that has been prevented by giving more medication to expecting mothers, for example. So there are less new infections in babies. There are less babies born with HIV in Africa than there used to be. And then in other areas, it's still persistent. It's the same prevalence. New infections every year are the same. And in other parts of the world, it's actually increasing. So in Southeast Asia, the regions around us, HIV prevalence is increasing. So the data that I'm going to present here, there's not much. I just want to give you, as Alison said, just an overview of the epidemic in Australia. And the data comes from an annual report that's published by the Kirby Institute, and you can find this annual report online every year. And in Australia, there are 25,700 people living with HIV. So the population of, I don't know, around 23 million or whatever it is. It's about 0.1% of the population have HIV, so it's a low prevalence country. And on average, the last couple of years, we've had just around 1,000 cases a year. Last year, we had 1,250 new HIV diagnoses. It's important to know too that the trend in the HIV epidemic differs in different states. So what we see, the numbers we see in Victoria and the populations affected in Victoria are different to the populations affected, say, in the Northern Territory or WA. For example, in Victoria, which I'll show you later, there's the majority are men who have sex with men who are affected by HIV. In WA, for example, much more of the heterosexual population is affected by HIV, so it's kind of like half-half. Half of them, or half of the new cases are among gay men and half of them are among heterosexuals. Whereas in Victoria, for example, it's about 20% in heterosexuals. So overall in Australia, HIV continues to be transmitted mostly through male-to-male sex, so it's about 2/3 are among gay men. And we have similar per capita rates among Indigenous and non-Indigenous populations, and what that means is that the number of individual